to tell you.
So welcome back, Mr. Johns.
Minister, for being here, and to all the public servants that are serving our country, and especially health officials. Really appreciate the work that you're doing. Minister, will the Canada mental health transfer that you promised to Canadians, and it's in your mandate letter, be in the budget next week?
Thank you, Gordon. Thank you for continuing to push the need for resources for mental health and substance use. I think in my opening remarks, I was clear that what has been established is that the more effective way of delivering excellent, appropriate mental health and substance use care is by integrating it into primary care, into the support for health human resources with freestanding mental health programs and substance use, as well as in the data. So we will see in that $25 billion that there will be dedicated dollars. All of the provinces and territories have established mental health as a priority.
Okay, I've got some questions around that.
And we will work with them on their action plans with indicators as well as targets, as well as be able to make sure that in that elevated Canadian health transfer, that they will have more money for treatment in their provincial
that's a no
budgets.
then in terms of the direct transfer. But we know that Canada spends, a woefully low amount on mental health and substance use, in regards to healthcare, below most of our G7 and OECD partners, and it shows. In the absence of the Canada mental health transfer, can you guarantee then that the provinces and territories will allocate funds to mental health and substance use under the bilateral health agreements to the amount of 12%, which is around what our G7 and OECD partners are spending?
I think that Eric and I should have introduced both Shannon from the.
I wish we had time to do a big introduction, but I'm just asking, will we be at 12%?
Well, in each of the action plans with each of the provinces and territories, we know mental health and substance use is a priority, and we will be working with them on adequate action plans to make sure that mental health and substance use is part of each of the priorities.
So what oversight are we going to have? What oversight are we going to have as Parliament over the bilateral health agreements? Will stakeholders and people with lived experience of mental health and substance use health concerns be consulted in the development of action plans? When are we going to know what's in those agreements? Because you've said $25 billion over 10 years. That's $2.5 billion a year in 4 priority areas. How are we going to know how much is going to mental health and when?
Well, that, I think, is what's exciting about this new approach, which is that the action plans will have all of your stakeholders can really try and influence the kind of indicators. What should be measured? What's a reasonable target? How do we influence not only the federal government, provincial governments, and making sure those action plans are clear? Because the action plans aren't reporting to us or even to parliamentarians. They're reporting to their citizens.
They need to report.
And that actually, it needs to be transparent and accountable, and that's where we're going. They must post the action plan.
Okay, so Minister, our job is to hold you accountable.
Thank you, Minister. Thank you, Minister. Go ahead, Mr. Thank you,
Canadian
Minister.
Institutes of Health Information are helping with those indicators.
Thank you, Minister. We're trying to keep the answers the same length as the questions. Go ahead, Mr. Johns.
We're prepared to step in and fill gaps created by provinces and territories that fail to put these dollars to mental health and substance use. Are you willing to do that?
I think what these action plans will be negotiated with provinces and territories. That means that the priority areas, the indicators, the targets will all be an agreement between the federal government and the province. We are insisting that mental health and substance use be part of each one, and then they will have to make that action plan transparent to their citizens, and they will be accountable to their citizens.
I'm worried about transparency to parliamentarians, because our job is to hold you to account, Minister, to make sure that the money's actually flowing to the communities. So I'm concerned because I'm not getting answers around